I have to do limited amount of work because after working the hands will get tired.
Okay.
And etc. When the hand's tired, some big veins and whatever is in the hand it will fall. I had a spinal injury suffering from my C3 for T1 and that's caused
That's in the neck and the upper back.
And the upper back. My life, yes, because I'm able to go about the way I would love to go about the business, and I'm an active person in church, which I cannot do it anymore.
Okay.
So it have me away. But I'm giving thanks to God that I'm able to open about still and can help myself without depending on anyone. Then having a spinal injury, I will ask you to be obedient to whoever you have around you, instructing you what to do, such as like the physio, the doctor. Just do as they told. And in addition to that, with the help of the Lord, just ask Him to help you and He will guide you. Because
In Office with Dr. Jevon Samuels.
Yes, welcome to another episode of In Office. I am Dr. Jevon Samuels. In Office is our program which we talk about life, sickness and death, and today we'll be discussing spinal cord injury. And my guest here is no other than Miss Walsh. Welcome to the show.
welcome.
Okay, good. All right. So first I'm just going to give a brief overview of spinal cord injury, and then we'll get into the podcast discussion with Miss Walsh. So spinal cord injury is normally an injury to the spinal cord, and the spinal cord is enclosed in the spinal column, and it's actually act as a gateway for communication between the brain and the rest of the body. It does this via 31 pairs of spinal nerves, which is exited from the cord through the spinal column. So we have 8 pairs of cervical nerves. We have 12 pairs of thoracic nerves. We also have 5 pairs of lumbar nerves, and 5 pairs of sacral nerves, and 1 pair of coccygeal nerves. Spinal cord injury, it's main often than not a traumatic cause for the spinal cord injury, such as motor vehicle accident, gunshot wound. It can be a fall from height, it can be a simple fall at the workplace, it can be from sports injury, and so forth. But it could also be a non-traumatic cause of the spinal cord injury, such as maybe a tumor that compresses the spinal cord. It could also be an infection at the level of the spinal cord. It could also be other central nervous system degenerative disorder of the spinal cord, and so forth. Now, spinal cord injury is normally classified based on the level of the injury, or sometimes it may be classified based on whether it is a complete or incomplete injury. So, based on the level of the injury, if the injury occurs at the level of the cervical nerves, that is at the level of the neck from C1 to C4, then it's normally termed tetraplegia or quadriplegia. That is when we have a loss of the motor and sensory function for all 4 limbs. So both the hands, the trunk, and the both legs function is done. We also have paraplegia when we have loss of function of the lower limbs only and preserve the trunk and the upper limb muscles. So, for example, if we have an injury from the thoracic level of the spinal cord, it will only affect like the abdominal muscles as well as the muscles in both lower limbs. If the level is at the lumbar or sacral region, then it affects mainly the lower limbs. In addition to affecting the muscle function, if it's an injury, it can basically affect both the sensations of unable to feel like pain or different temperature, as well as will be unable to carry out any muscle function, what we call motor function in your toes. So we're unable to move like the ankles, the toes, etc. Now, it also can affect some other organs of the body, such as the bladder. So we'll probably have impairment in the void in urine, also have impairment in bowel movement. And if the injury is higher up, like cervical spine, when we have the tetraplegia cases, we can also affect both swallowing, speaking, and even breathing mechanism. Now, another means of classifying spinal cord injuries, whether it is a complete or incomplete injury. So a complete injury is when we have the spinal cord is damaged in such a way that we lose both the motor and the sensory function from the level of the injury downwards, right? However, based on the American Spinal Injury Association, we can also have incomplete injury, which is normally graded from grade B to E. And but for this podcast, we're not going to get into the intricacies of the details, as in what classified as B, C, D, or A. Just to note that whether it's a complete injury, then it's classified as a spinal cord injury A, and from B to E is when we have incomplete injuries. Now, for the general public, some of the things that you should appreciate from this podcast is that whenever we suspect spinal cord injury, for example, if you should be on the site of a motor vehicle accident and you can see where the person is unable to move their limbs, etc., it is important that you try and stabilize the patient as much as possible on the scene. So if it's the case where you can get some form of rigid support to keep them in one fixed position, you don't just go and lift their hands or lift them up like how you would normally do. You have to ensure to stabilize them as much as possible to prevent further spinal cord injury. Because the initial spinal cord, when we have spinal cord injury, we are unable to recover the damages. We will be unable to recover spinal cord injury. Like we cannot, it won't recover. So the best we can do is to prevent further damage. So to prevent further damage, we normally keep the patient as stable and fixed as possible, and move the patient as a whole fixed unit, and try and avoid any twisting or bending of the neck or the trunk. Also, it's that is the reason why, if, for example, if a person have a spinal cord injury, the earlier they stabilize and get cert, and the spinal column is corrected surgically, then it's a better chance of overcoming the rehabilitation process will be much faster. Now, if someone has spinal cord injury, they'll find out that way. They normally, if it's a complete injury, some persons might end up using a wheelchair, some might need to use a walker, and they have other modern rehabilitation assisted devices which can be used to help let the patient function to as best of their ability based on their disability. But with no further introduction, I just want to get into discussion with Miss Walsh here. She actually is a patient which had a spinal cord injury, which was an incomplete injury, so she had recovered some of her disability to an extent, but however still have some form of impairment in her both motor and sensory function. So welcome once more, Miss Walsh. Thank you to Inner Office. All right, good. Now tell us a little bit more about your spinal cord injury. What had happened?
Okay, my spinal injury occurred in 2013. However, I was admitted in December. I had a fall here at work,
Yes.
and I was seen by the doctor immediately on the ward. Afterward, about a week after I was coming to work, when I started to feel lower back pain, lost muscles, movements in the feet and the back there, so I decided to go to the doctor the following morning. And I went to the doctor to do an x-ray, and at this point in time, doctor, I've never seen that x-ray because I have to go back down to A&E immediately that same day, and they admitted me and they walked. When I was admitted, they realized that I had a spinal injury suffering from my C3, T1, and that's caused it.
That's in the neck and the upper back.
And the upper back. And I couldn't walk then. So I did a surgery in January of 2014. Still no movements. No movements of the toe, the feet, nothing at all.
Oh, the hands were able to move?
The hands were able to move, but after the surgery, when I lift the hand up, it would come down and without controlling it.
Alright, so let's try and get a better understanding of the initial injury. So it was a case where you had a fall, but you didn't have any loss of motor problem at the time. So the initial fall, you were still able to walk up to a week normal.
Right.
But you were having severe pain in the back.
Right, in the lower back.
So at the initial fall, did you seek medical attention?
Yes, I said the doctor on the ward look at me and then they refer me down to A&E, which I did an X-ray.
And that was
That's it.
normal.
The doctor didn't get to read the X-ray up till now, because I was supposed to take back the X-ray to Dr. Neil the following Tuesday when I was admitted, the same Wednesday.
Oh, so they had done the X-ray, but they didn't read the
Didn't get to
X-ray.
read the X-ray, I didn't go back to the doctor.
Oh, that was. Oh, you
I
didn't
did
go
the
out to.
X-ray the Tuesday and I was admitted the Wednesday. Because when I went home, started to have pain, catching pain, not able to move. So I came back in and the doctor admitted me
Okay.
at that time.
Okay, so basically you were at home and then you were unable to move your legs.
Yes, but with assistance of a walker.
Okay,
Start
so
to walk at
weak.
the- yes.
And before the fall you were normal functioning. Tell us about any other system were affected. Like, did you have any issue passing urine or stool at that time?
My urine, I could pass my urine, but whenever the pieces start coming out, it was uncontrollable.
Or so you couldn't control the
No,
stool.
I couldn't process.
So it's about the urine. You could control the
I couldn't
urine.
control the
Still
urine.
control the urine.
Yes.
Okay.
But at that time, after surgery, physical and all that, I was able to.
So initially, when you had the weakness, did you have any? Did it affect your breathing pattern or your speech or swallowing?
No, it was amazing to the doctor that those things wasn't occurring.
Okay. All right. And so you said the initial thing was a simple fall, and then a week later you developed weakness. So what did show on the X-ray? Did they inform you about the X-ray?
No, because I admit with all the extra, I left the extra at home. I didn't take back the X-ray when I was coming back to the
Okay.
doctor.
Yeah, but when you came back to the doctor with the weakness, they had done further imaging like
No,
MRI or X-ray?
Yes, they did an MRI. They referred me to do an MRI now.
Okay.
And that's where the MRI showed that my C3, C4 is
T3, C4,
Yes.
and T1.
and T1 that was pressing on her spine.
Okay, so it was like a slip disc or a fracture. I don't remember.
I don't know. if
Alright, but that's the
But
level
they
which
said
the
the
spinal
bone
cord
shift,
was.
whatever, when I have it all, the bone shift and start to compress.
Okay.
Spinal compression.
Spinal cord compression.
Yes.
Okay, alright. And so now tell us about the time when the admission for that injury. What are some of the stuff that they did?
When
at the ward?
when I came in on the ward, quickly they put on the C collar to stabilize so that it doesn't get worse. So after stabilizing the C collar on it, so they're going to do an operation which I need plate.
Okay.
So I added a plate at my neck here.
So what's the cost for the plate? I know that even in the government system, even if the surgery is free, you still have to purchase the implants. So what's the cost for those?
The cost of the plate was 150,000, but it was bought here.
That's what, okay.
Mm.
All right. And how long were you admitted for the surgery?
I admitted on the 7th of December and I did the surgery until the 25th of January.
In terms of the surgery now, so you were admitted for a week before the surgery or longer?
As I said, I admitted the 7th and the ward and I didn't do the surgery until the 25th of January.
25th of January.
Yes. So the whole of December I was on the ward and actually the whole of January.
So what did they have any form of traction or you were just the line of the
Just the C color.
the C color was
the
on
C
it?
color and
Okay.
painkiller.
So during this admission, you were unable to walk.
No, I wasn't walking. I was able to sit up in the bed and I could roll on the window or wherever close to the bed and move, which the doctor required me not to move. I must just stay in bed.
Okay, but you could have stand up.
But I could have stand up but couldn't bear the weight.
Okay. Alright. Okay, so the surgery now, they did the surgery and how long did the surgery last?
Surgery last about 8 hours or so.
8 hours.
8 hours.
Okay.
Because they moved one from my hip here
Yes.
and put it around my neck too, along with the plate.
Okay. Alright. And so after the surgery was successful?
Yes, it was.
Okay. So after surgery now, did you have any further weakness or you had gain back strength at the same time?
When I didn't gain back strength at the same time, because it take me another month and so, that's when they decided to send me to Monterey because there were no movements in the feet, toe, but the hand, after operation, I lift the hand and will just come down without controlling and just hit me.
Okay, so you're saying that after the surgery, I had got a little weaker in the upper limbs to the hands.
Yes.
Okay, all right. So yeah, transfer from the hospital to Mona Rehab.
Yes.
And then what are some? So the physiotherapists work with you at Mona Rehab.
Yes, man,
So what are some of? Okay, so what are some of the stuff that they help you out with at Mona Rehab?
First, I would go on the movement machine.
Yes.
Do the working out first. Then they would allow me to hug a machine, so you hug it up tight.
Yes.
Then I would do the wheelbarrow one where I would move behind me and they say, oh, building the muscles.
Upperly.
Yes. And then there was this feet one that they would put on it, a lot of hands on it.
Yes.
And they would also put my feet up on some, I can't describe it better now.
Okay.
And they would ask me to say lift, if I could lift it up and keep it up for a little while, which I tried. And after that, then I would move on to the one that you walk in.
Walker.
No,
That's it.
the one that will able to bear your weight. I don't remember the name, but it's a long little iron from there to down there.
Something similar to a treadmill.
No, not a treadmill. Wow, I forget that name.
Okay, all right.
But I would walk in that, and I would walk up, down. They said up, down will be 1, and then another up, down will be 2. So they would
Okay.
allow me to do 20. Which sometimes I would be able to do 20
Okay.
because of the weight bearing, but I would try my endeavor best to. And it helped me a lot.
Okay. So so how long were you at Mona Rehab?
4 months and 2 weeks.
4 months and 2 weeks.
Yes.
And at this point, you were bedridden.
Parallel bar, the thing that I would move it. Parallel bar.
So what else did you get? Like you're teaching you to
Walk
come
again.
from bed. Oh, you were being taught to walk and not
again.
just to use a wheelchair
Right.
because they had the strength.
Because I start to build the muscles now and I see where I can keep up a little. They test you first in the parallel bar now. And
Okay.
if I can keep up, which is says behind you, if I can keep up now, then that's the physio they will keep you
Okay.
on for a good bit more and let's say that.
So how was this 4 months experience like at Mona Rehab overall?
When I rehab, it was good. The treatment there is good, the people there are nice. So I would move from the wheelchair to the walker, and from the walker to the quad cane, and then from the quad cane now home.
Okay. All right. And then, so what are some of the devices that you have to use to? Because you're not using a wheelchair, so do you use a walker now? What do you use?
I use a single cane now.
Okay.
Single cane.
I
Quite
see.
simply, because the balance is not 100.
So you lose some coordination and balance.
So the
type of thing.
balancing is not. If I try to go without the stick, then I would maybe end up in problem. If I walk up on like some rocky road or rocky surface, and the balance I would fall. Even yesterday when I fall.
You fall yesterday even? Okay, but you were okay. You were walking without it.
I went around the back of my yard to feed my fall, and was just walking without it, and where I lost my balance.
Okay. So now, looking at your life now, before and after the spinal cord injury, how has it changed? Luckily, you're still able to do your job, but I mean, how
It changed my life. Yes, because I'm able to go about the way I would love to go about do business, and I'm an active person in church, which I cannot do it anymore.
okay.
So it's have me away. But I'm giving thanks to God that I'm able to open about still and can help myself without depending on anyone.
Okay. And in terms of your work environment now, because I know that your work would have probably before the injury would have probably lift a lot and do more.
Right.
hectic. So what that changed?
I am able to live, stand for a long period of time and walk long period of time. So I have to be limited amount of work because after working, the hands will get tired
Okay.
and etc. When the hands tired, it's some big veins and whatever is in the hand it will fall.
Alright. So apart from the surgery, did they give you any form of medication to help? Like,
Yes, I get gabapentin and the gabapentin I get Voltaren and Ketaflam.
okay, but you're no longer on the cataflam.
No, I just have the Ketaflam for just in case being alright where I'm unable to bear, then I would take it. But I try to bear the pain as much.
Okay, so since the injury, you have to be on gabapentin.
Well, I'm
So
not on the gabapentin anymore because what the gabapentin did is like turning a zombie.
Okay, meaning what?
When I take it, I will step high.
Oh,
I will sleep.
okay.
So I spoke to the doctor and they take me after and put me on the Panadol.
Okay,
So
so
I
that's
presently have the Panadol.
Panadol for the pain.
Yes.
All right. And so if it's a case where your injury, did it affect the bladder or the bowel any at all?
No,
Never. You never have to wear a catheter.
Yes, I didn't have to wake it up because of they don't want me to wake the bed then and because I'm unable to come out from the bed. That is the reason the doctor said. It takes a catheter here. So I won't wait and because I can't move to go to the bathroom. But it gives me effect.
So you're wearing diaper at one time? You're in diaper?
Yes.
All right. But I mean,
But I used to fail to pass my stool in the diaper. I would always fall for the bed.
okay. All right. So it's the case where normally to put in a catheter, normally have a higher risk of. So the only reason that they are putting the catheter is because you are unable. They want you to wet the bed.
Right. Because I'm unable to move to the bathroom. And then we might wet the bed and have to be in it for a long time. You don't know the story.
Okay.
Yes.
All right. All right. So luckily you had an incomplete injury. So for some persons that have spinal cord injury, especially if it's motor vehicle accident, gunshot wound, they would basically have a complete injury where they would be unable to move or feel anything below the level of the injury. So luckily your injury was initially probably missed initially, but end up still was not severe enough to form a complete paralysis, which is good.
Right.
All right.
So I was able to have a sensation at the feet. So you know when you stick me or you pinch me or you slap me.
I still had the sensation.
Yes, essentially was good.
All right. And so, in summary now, what advice would you give to others which have spinal cord injury or whole?
Well, in summary, for persons that are listening and having a spinal injury, I will ask you to be obedient to whoever you have around you instructing you what to do, such as like the physio, the doctor. Just do as you're told. And in addition to that, with the help of the Lord, just ask Him to help you and He will guide you. Because some of my physio is the Lord's talk to me what to do. With all my hands movements, He would tell me to take up the book and do a cross and pile puzzle with it. And when the physio came and I told them what I did, they said that's what they were about to give me that morning.
Okay.
So I started before them. And at one point when I was at Monoria, remember the Lord woke me up about 3 o'clock in the morning and He said I mustn't try to kneel on my knee, which you know that's very hard, but I tried.
Okay.
When I kneel on my knee, the Holy Spirit said I must pump up my back like a cat.
Okay.
And I did it, and it was very painful. But when I went to physio the morning, I was telling my physio, she said, "Oh my word, you did it before I introduced it to you."
Okay.
And that was the physio they introduced for that day, and I was able to manage, master it, and thank God.
Okay. All right. Well said, Miss Walsh. All right. Good. All right. So viewers,
Having me.
sure. So viewers, remember to share, like, subscribe, and leave a comment on this video for more informative medical content. So today we discuss spinal cord injury. It's Miss Walsh had an incomplete spinal cord injury, and she took the time out to share her story with us, which we are grateful. And I hope this information is helpful to someone that's watching out there and can share with others that may have spinal cord injury and want to hear information about spinal cord injury. Until next time, keep safe.
Be sure to subscribe for more informative contents on life, sickness, and death.